Good morning, everybody, and welcome to another session of the AFR EMS case studies. My name is Chris Ortiz. I'm the EMS Division Chief, and today I'm joined by Medical Director Dr. Kim Pruitt. Welcome, Doc. And also Captain Melvin Martinez from the Heart Division.
How you doing, Chief?
Thanks for joining us, Cap. So today, we're going to discuss what was absolutely an interesting case that we discussed even at the QA meeting, and it was in regards to a fentanyl/Tranq overdose that you responded to while you were working on Rescue 7 or Engine 7. Is that right?
Engine 7, Chief.
Engine 7, fantastic. Okay. So Engine 7, Rescue 7 AS, you guys responded code 3 to a 23 Delta, and it came in as a 13-year-old male for a drug overdose. So you're on your way to that call. Talk with us about what's going through your head and what you're thinking about en route to a suspected overdose of a kiddo that age.
Sure. So it seemed like a pretty routine call. Alarm room came over. We got toned out to an overdose and kind of already gearing our mind towards the overdose. Show up on scene. Family member was flagging us down. The whole crew walks in. Engine 7 walks in first, and we make contact with patient's mom.
And what did mom tell you? What did she say?
That was interesting in that she was very calm. It wasn't the typical hysterical, I'm worried about what's happening, Mom. There was a fence at the bottom of the stairs to keep animals from walking around. And I asked her, can we get that removed? And it was bolted to the wall with screws and not just like clamped in. And she goes, no, it's okay. My sons jump it really easy. And I said, okay. And it's almost as though she didn't know what was happening upstairs. So a little bit odd. We walk upstairs. The first thing we see is a young gentleman, really ashen skin, white on his face, his neck, and his extremities, laying supine. And he had a game controller next to him. There was a video game playing. No signs of any paraphernalia on scene. And so the crew went to work. Checked pupils. Patient was agonally breathing. Try to get some information out of his brother. And what we got from the brother was that he was asleep. He heard snoring when he went to the restroom. His brother doesn't normally snore. And so he took a peek in the room and found his brother like that. Unknown downtime. Asked him if he knew about what he took, what happened. And he was a little bit apprehensive in answering any questions. Kind of probed him and poked him a little bit more, let him know that it's important that we know what's happening. And he says, well, this happened to him before, but they brought him back. And I asked him, what was it? And he said it was probably fentanyl, and he mentioned the word Tranq. It didn't cue me off as though xylazine, with all the information that you and Doc Pruitt have put out. And the rescue lieutenant picked up on the word Tranq. And so it was a quick conversation between all of the crew, and as we knew that we had some work to do.
Okay. That's a great job of probing and asking those additional questions. Because I think a lot of times family or the patient themselves are hesitant to give that information, even though they know the substance, so they have an idea of what they took. They're not going to be real forthcoming with that, so it was a good job by asking those additional questions to get to the bottom of it. So you mentioned that the airway was clear. You had pupils. Were they pinpoint?
Pinpoint, non-reactive.
Okay. And as far as initial vitals, it looks like you had documented a heart rate of around 111. You said he was satting only 60% on the room air, and that was evident, obviously, in his skin being ashen and cold.
Yep.
Breathing about 5 times a minute, and you had a capno. You did capno as well, and it got a reading of about 51.
Yep.
Okay. So talk us through your next steps after you do that first initial assessment. You know what's going on. You have an idea of what the drug that he took was. What was your next steps in terms of treatment?
Yeah, so the first thing we did was we jumped on the airway. There was nothing to suction, but we did jump with a BVM, started bagging the patient. First initial thought was to get that first Narcan IN, so 2 milligrams of IN Narcan. I was lucky to have a paramedic on the truck who started working on the line as well. Just a lot going on with that initial care.
And you may mention the brother talked about Tranq. Doc, it was the first time I had heard about it until this case came up. So what do we know about Tranq and its effect on patients?
Yeah, I'm super excited you brought this one up when we were talking about it. Tranq is the street term for xylazine, and we've been hearing about xylazine contamination in the fentanyl supply for a little over a year, but it hadn't quite reached Albuquerque yet. And this is our first time that we've actually had someone say that they're seeing it. It's actually a horse tranquilizer and a very powerful sedative, and it can't be reversed with Narcan. causes profound sedation, and sometimes it causes over time some necrotic skin wounds as well. So I suspect over the next couple of years we'll start seeing those creep up. But just another contaminant in the drug supply to keep an eye out for. And the important thing to know about it is it doesn't respond to Narcan. So if you find a patient that thinks they took fentanyl or says they took fentanyl, they may be requiring more Narcan than normal to start breathing again. And I would say about 6 milligrams to 8 milligrams of Narcan. If you reach that point of Narcan, it's about the time to stop and consider just a polysubstance overdose. And at that point, just focus on managing your ABCs and treating what you see in front of you.
That's great to know. Thanks, Doc. So hearing that now, obviously not having this information then, we initially administered the 2 milligrams of Narcan, and how did the patient respond?
So we got no help from the Narcan the first dose. So we, like I said, we already kind of like knew we were up against something big, so we pushed another 2 milligrams of Narcan, maybe like 3 to 5 minutes afterwards, and still no positive response. And of course it feels like time is forever, but we went ahead and pushed that third dose. And little by little, after talking to the pipeman, patient still wasn't really breathing on his own. We were still begging him. And little by little, he started kind of like trying to breathe, started making a few movements, and then he finally came around. Got a little combative for a little bit, and then went relaxed pretty soon after. So it was good to see that finally it started touching him and started giving us the results we wanted. I think I'm always so used to one dose and maybe a second dose, and they start coming around and asking, what are you doing there? But this wasn't happening. That's what was a little bit concerning.
So your focus really in that time frame, because you're right, it feels like an eternity when you're doing these medications that typically work so quickly, and now we're seeing this delay. So your primary focus during that time was just on ABCs, maintaining his airway, breathing for him, and trying to help that circulation, everything else along. Is that fair to say?
That's exactly what happened. Yep.
Okay. All right, so wow, so 6 milligrams in, so now we start to see a little bit of a response. He's a little bit combative, and then he starts to relax a little bit. What happened after that?
Yeah, so he got carried down on a mega mover. Obviously, the little animal gate was removed. Got him in the back of the ambulance. AS started doing their thing. And the rescue lieutenant and myself got mom and brother involved and kind of let them know what was happening, educate them on what just happened, let them know that we have some leave behind Narcan. We gave her a quick educational class on how to use it next time, what to look out for. And she seemed really prepared, and she made the comment, like, I've learned how to use that at work. So we felt pretty confident that, the Narcan was going to be in good hands should she need it. We kind of let her know that she needs to get a little bit aggressive with her son and try to get him the help he needs. And 55, I uploaded my chart to them. Rescue went ahead and cleared, and we jumped in the engine, and we're clearing, and we're starting to drive away. And that's when the AS medic driver flagged us down and asked if I could ride in. They need another medic. Mm-hmm. So I jump in the truck, and the patient looked a little bit declining, I guess, if you will.
Still awake?
No, never was awake, unconscious
really
the whole time. That was a good question, Chief. And the 55 medic told me he started seizing, so I pushed 5 milligrams of Versed.
Okay.
And I need help. I said, okay. So we jumped in. We decided to go code 3. And en route, we try to get a 12 lead, try to get a better workup of his vitals. And shortly after, we started seeing the patient have a lot of like pink frothy sputum. Okay. So then we started moving into like suction of his airway. I think in all we might have pulled like 30 to 50 cc's of fluid that we suctioned. And we just managed his airway the whole way. We gave a non-rebreather, had that high flow the whole time. And I want to say his SATs got maybe in the low 90s, high 80s.
Did you ever witness a seizure, or that just was the Albuquerque ambulance? Did the patient continue to seize?
So patient did not seize. I never saw the seizure. It was all in the time span of us educating the family on Narcan and then clearing the scene. So I never saw that.
Fantastic job of taking that time for the customer service piece to kind of educate the family. The Leave Behind Narcan is a great program. We'll talk a little bit more about that later.
Sure.
Doc, you'd mentioned the seizure. Obviously, we didn't see it, but the Albuquerque ambulance medic did. They were able to treat it early on. talking about the seizures and the pulmonary edema that we're seeing, what are the thoughts or the science behind why that's happening? What's the discussion?
I think this is actually a really incredible call. And I don't know that there's technically an explanation for this right now in the literature. There's some hypotheses. We know that there used to be a teaching that Narcan could cause pulmonary edema, and we use so much Narcan, we pretty rarely see it, but it's a known side effect. It could have been the higher dose Narcan that caused it. I don't think that's the case necessarily. My suspicion is that when you reverse the opiate overdose, there must be some sort of sympathetic swing to where there's a really big adrenergic surge with an increase in blood pressure as the respiratory rate increases, heart rate increases, maybe increases the pressure in those pulmonary capillaries, and that could be causing the pulmonary edema. Same thing with the seizures, just a surge of adrenaline can do the same thing to the brain, would be my suspicion. I don't know that that's proven by the science yet, but physiologically, to me, it makes sense. What we do know is that with any polysubstance overdose, which is what this is, who knows what he took. I think the toxicologists are still studying his blood work to see what was in it. We know to watch out for seizures. We know to watch out for hypoglycemia, and we know to watch out for cardiac arrhythmias. And it sounds like you nailed every single one of those. So even if you don't know what they took, we can still manage airway, and we can know what to watch out for next.
And the takeaway from that is ultimately the life threat is going to be the respiratory depression leading to respiratory arrest. So treating with high-dose Narcan to try to reverse that is what you guys did. That's really our only goal. So if the secondary is the seizures and or the pulmonary edema, we got to be prepared to handle that, but it's not going to prevent us or slow us on our Narcan
No,
use.
absolutely. Still give the Narcan. I'd say start to think about stopping with the Narcan about 6 to 8 milligrams, right where you did. And if they do seize and develop pulmonary edema, you still manage your airway. We can do that, and then treat the seizure.
And treating that with benzos is okay.
With benzos is
and that's
fine.
what Albuquerque Ambulance did. Okay, fantastic. And okay, so talk to us those last couple minutes on transport. Any changes in the patient's condition at all?
So not really any great improvement other than we just suction and maintain his airway. He remained the same in the entire trip. So at that point we were, just getting ready to do a good solid turnover, and when we got to the ED, they kind of started from square one too with what we've done, and it was interesting to see that he never truly came around.
Mm-hmm. And just focusing back, like we said, those ABCs, going back to basics and making sure that pulmonary edema, we can handle it. It's obviously a young patient. This is secondary, not to necessarily just a respiratory issue. This is because of the overdose. So
Right.
You guys did a great job on that. Blood sugar, did you guys keep an eye on that throughout the way?
I can't specifically remember. I was kind of busy with his airway. I can't remember getting him blood sugar. If I did, it's probably in my chart, but I'm not sure.
Yeah, and just keeping an eye. We know the importance of checking that blood sugar, not only from the patient who seizes, but also just from the overdose patient to just rule out, because we don't know absolutely what's going on. So that was fantastic. Great case. This is an eye-opener for a lot of us. I think we want to get a lot more information out in terms of Tranq, in terms of fentanyl in general. Like, we don't know what we don't know yet, so we're kind of learning as we go. But you and your crew from Station 7 did an outstanding job of handling this patient. It really saved a life.
I have to say, I was really impressed with the crew. They're just automatic. They were just very intentional, very decisive in their treatment. Everyone just jumped in there and just started working. It was actually really good to see.
Awesome. In our last 30 seconds that we have, I want to give you an opportunity to talk through real quick your Leave Behind Narcan program through the Heart Division. What
Thank you,
guys are
Chief.
doing.
That's important. So Leave Behind Narcan, those of you who don't know by now, it's basically some Narcan that we get. I make a little kit. It comes with 2 doses of Narcan. It has a Suboxone flyer in there for a number of how to get some help. It has a couple of fentanyl test strips and some educational literature in there. I guess the main point is ask for it. Right now, if you send me a text, I'll get you some as soon as possible. There is a little bit of lag from ordering to getting it to the streets, but I think one of the main questions I get is, how do I get some? And you do not use vector solutions. Just have people text me directly, and I usually make a once per month inventory where I shoot out a text to the entire department and ask where they're at, inventory-wise.
That's right. And talking about EMS prevention, right? It's the calls that we don't know, the patients that we don't know how many we've saved because of initiatives like that. So I appreciate you taking that on and doing
Thank
that
you.
work.
Thank you, Chief.
Well, great job. That's it for today's case study. Thank you, everybody, for joining in. If you have a specific case, reach out to your 7-8 or get on the SharePoint tab and let us know and come and record. Until then, we'll see you next time. Thanks.